We're learning new details tonight about the financial impact the pandemic is having on hospitals. St. Francis says it's absorbed millions of dollars in expenses. News on 6's Jonathan Cooper joining us now live downtown Tulsa with what he's learning tonight. Coop.
Brian, St. Francis says that CARES Act funding has helped pay for some of these expenses, but not all of them. And like many hospital systems, St. Francis is having to adjust the way that they do business. Now, Deborah Dage is the Vice President of Finance for St. Francis Health System and says their goal throughout the pandemic has been to serve the community and not to add any more financial stress on people already struggling. That's why she says they are not billing patients for COVID-19 services not covered by insurance. Dage says the pandemic has also provided some additional costs for the hospital system. In 2020, she says they spent $4 million paying employees who were out sick or quarantine, $7.4 million on additional salary costs, which includes incentive pay and travel nurses, and $20 million on retention bonuses that included a 3% raise for employees. They also spent $6.5 million on capital projects, $9.5 million for COVID testing and lab supplies, and anticipate spending $20 million on COVID-19 treatments and drugs.
We continue to incur these costs across the health system. The fight isn't over. Even though Dr. Robertson showed our numbers are decreasing in the last few weeks, we continue to see new COVID patients every day.
St. Francis also announced today that it is giving out booster doses of the Pfizer vaccine. Reported live in Tulsa, Jonathan Cooper, Oklahoma's Own News on 6.